So what does your dentist have to do with human rights? Probably a lot more than you think. Today we're going to unpack a really complex story about medicine, ethics, and human rights. And it all starts in a place we all know, the dental chair. Let's get into it.
Okay, so to really get to the heart of this story and its ethical challenges, first we have to grasp the sheer scale of the HIV epidemic in South Africa. And it really kicks off with this one, stark fact. South Africa has the largest number of people living with HIV anywhere in the world. This isn't just another health issue, it's the global epicenter of the epidemic. And that context, well, it's absolutely crucial for everything that comes next.
Yeah, and this quote from the Health Professions Council of South Africa, it just frames it perfectly. It's basically saying that HIV, maybe more than any other disease, forced society to take a hard look at its basic values around human rights and discrimination. It turned a medical problem into a deeply social and ethical one.
Okay, so with that massive challenge as our backdrop, let's zoom in on a place you might not expect to be a front line in this fight, the dental office. The role of the dentist, or the oral healthcare practitioner, is way more critical here than you might imagine.
So why are dentists so important in all this? Well, for one, they're often the very first people to spot the signs of diseases like HIV in a patient's mouth. That makes them these crucial gatekeepers in the healthcare system. And now, with the rise of simple oral HIV tests, their job as public health promoters has gotten even bigger. They are quite literally on the front lines.
And this right here, this brings us to the central conflict of our story. See, it's not just a battle against a virus. It's a battle between the destructive power of social stigma and the cold, hard facts of medical science.
And wow, this quote really gets to the heart of it. The stigma that surrounds HIV, it doesn't just hurt people's feelings. It costs them their jobs, it can tear families apart, and it can even lead to violence. And maybe worst of all, this fear is what stops people from getting tested and seeking the very treatment that could save their lives. This slide just lays out the disconnect perfectly. On one side, you have the devastating results of stigma, fear, secrecy, and avoidance. And on the other side, you have scientific reality. HIV is preventable. Incredibly powerful drugs called antiretrovirals, or ARVs, can suppress the virus, and clear safety protocols can make transmission in a clinic almost impossible. So, how in the world is a healthcare provider supposed to navigate this minefield of fear versus fact? Well, they use an ethical compass. It's a framework built on 4 core principles that are meant to guide every single decision they make.
First up is autonomy. And this is a simple but really profound idea. You are the boss of your own body. A doctor can explain everything, give you all the options, but at the end of the day, you have the final say. It's your informed yes or no that truly matters.
Next, we have beneficence. This is the duty to actively do good. It's not enough to just avoid making things worse. A healthcare provider should always be acting in the patient's best interest, always trying to promote their health and well-being.
Then there's non-maleficence. This is the one you've probably heard before. First, do no harm. It's the absolute bedrock of medicine, the fundamental promise to avoid causing any preventable injury or harm to the person in your care.
And finally, there's justice. This principle demands fairness. It means that every single patient, no matter their wealth, their background, or their HIV status, deserves to be treated equally and without any prejudice.
Okay, so we've got our ethical compass. Now let's see how those big ideas actually translate into real-world rights and responsibilities when you're in that exam room.
This brings us to the sharpest point of the whole dilemma. It's the question that fear and stigma force us to ask. Can a practitioner just say no?
And the Health Professions Council of South Africa gives an answer that is crystal clear. Absolutely not. Refusing to treat someone just because of their HIV status is against every ethical and professional rule in the book. The duty to care is non-negotiable, period.
So here's the crucial thing to remember. This duty to treat isn't just a nice idea. It's anchored in a whole set of fundamental patient rights. The right to keep your medical information confidential, the right to say yes or no to a test, the right to get high-quality care, and the right to be treated with dignity. These aren't suggestions. They are protected by ethical codes and by the law.
All right, we've seen the problem, we've seen the conflict, and we've seen the ethical rules. So now we finally arrive at the solution. And it's an elegant and powerful system that just cuts right through all the fear and ensures safety for everyone.
It's called universal precautions, and the idea is really brilliant in its simplicity. Instead of trying to guess who is or isn't risky, you just treat all human blood and certain body fluids with the same high level of caution for every single patient, every single time. No exceptions.
So what does that actually look like? Well, it means using things like gloves and masks for every patient. It means being incredibly careful with sharp instruments like needles. It means sterilizing all equipment properly after every use and rigorously cleaning the whole clinic. These steps create one single, high standard of safety that applies to everybody, equally.
So this is it. This is the big question that this whole explainer has been building towards. After everything we've talked about, what's the answer?
No, it's just not necessary. Why? Because the entire safety system isn't based on an individual person's diagnosis. It's based on a universal standard that protects the healthcare worker and the next patient, no matter what.
And this final quote from the HPCSA really just seals the deal. When you have a disciplined, universal system of safety in place, knowing a patient's HIV status becomes completely irrelevant to the practitioner's own safety. Science and process replace fear and guesswork.
So our story ends right back where it began, in a dental chair. But the lesson is so much bigger, isn't it? When we replace fear with a single high standard of care that we apply to everyone, we build a system that's not only safer, but also much, much fairer. And the question that leaves us with is this: where in our own lives, in our own fields, can we apply that powerful idea?